Hi, this is Dr. Sunita Tandilwadkar, Director of Solo Clinic and Center of Excellence for Infertility and Gynae Endoscopy. Today, on a popular demand, I'm going to explain you what is IVF. I will try to be as simple as possible. In a later IVF, that is in vitro fertilization, many people call it as test tube baby. Now, what is this test tube baby? Before understanding, let me explain you in 1 minute how natural pregnancy happens. A lady from the start of a menstrual cycle try to produce many eggs, but only one egg try to go ahead, and if she has a menstrual cycle of 28 to 30 days, usually between 14 to 16 days, only one egg is released. As soon as it gets released, it is picked up in the tube. Now, during this period, if she comes in contact or she has a sexual relation with her husband and the semen gets deposited in the vagina, the sperm reaches to the tube where egg is staying. The egg and sperm undergo fertilization. To fertilize one egg, you need to have millions of healthy sperm. And this fertilized egg we call embryo, that is a small baby. It takes 4 to 5 days for the baby to traverse from the fallopian tube and enter in the uterus, that is womb. And if it is genetically very healthy embryo, and if the circumstances in the womb are healthy, natural, then the pregnancy happens. It means this embryo gets implanted into the uterus, and in 9 months the baby develops. It is usually first 3 months, or you can say more precisely in 10 weeks, all the structures of the baby is formed, and then from 3rd month to 9th month, it is the growth of the baby happens. So, this is how the natural pregnancy happens. Now, what is IVF? First important thing is, instead of one egg, when from the first day of a menses, as I said, many eggs start developing, but only one develop in a natural way. Here, those many which are started developing, we want them also to grow, because you can't give IVF or a pregnancy only with one egg. So what we do is, we do artificially induce all the eggs to develop. So from first day of a menses, we start giving you daily injection. The aim of this injection is allow all the eggs to grow. Now, we can't see those eggs with the naked eyes. We can't see those eggs on sonography. But every egg has one house that is called follicle. So these follicles can be seen on sonography. So when I say we give you injection, how much should be the dose? How many injections we should be giving? How many days we should be giving those injections? All depends upon how you are responding. So usually a lady needs injections between 8 to 12 days, depending upon her age, depending upon her weight, depending upon her reservoir, how many eggs she has. The doses are usually decided. So, after giving those injections for 5 days, from 6th day onward, we start doing your sonography. So, by doing daily sonography or alternate day sonography, we monitor the number of follicles they are growing, whether the dose is adequate, the dose of injection I mean, whether it is adequate or I need to step up or I need to step down. All depends upon the rate of a growth of these follicles. So we usually do your daily follicular monitoring from 6th day onward. And usually between 8th or 9th or 10th day, the follicle achieve the size. It means the eggs are mature, ready to come out, ready for fertilization. So once we see that, so that is very important. The person who is deciding, the IVF consultant, doing their own monitoring of the patient is very important. Do we do only sonography monitoring? 80% of the time, we don't need any additional blood test. But sometimes, if we see you are hyper responded or you are under responded, then we may do your hormonal test, that is the blood test. Now, once the follicles are mature, then we give you one special injection by which the eggs which are mature are also ready to fertilize and get release. So if I give you injection, after 35 to 36 hours, we take out those eggs. It means you have taken 8 to 10 days injection for the growth of an egg, and one day, one injection which usually falls in the midnight, because after 35 to 36 hours, we need to take your eggs out. So that midnight injection is to make the egg ready to be released from its house, that is from the follicle, and come free inside the follicle. Now, how do we take out those eggs? Entire this procedure happens on the OPD basis. You don't need to take any leave. You can come in the evening after your office hours if you are working. Monitor yourself and take the injection, same sitting, and go home. I won't say these injections are painless, but they are not very painful because they are not oil-based. They are water-based injection. It's like how any multivitamin injection you are taking. They are given usually in the buttocks, one day on this side, one day on this side. So usually the husband need to be little bit spreading the love or tender care towards the wife. We do expect, we do encourage, because in the entire process, it is the lady who receives this injection. Now, once this injection in the midnight is given for the egg to be released into the house, and when what I say is after 35 hours, we plan. Now, what will we do? That is the only day you need to be in the center, in the hospital, admitted for 6 to 8 hours. Usually 2 hours prior to the timing we admit you. We ask you to come empty stomach because it is done under anesthesia. This is not painful. You just receive one prick and then the anesthesia is given through that IV. Usually it takes 10 to 15 minutes for the entire procedure. It is done under sonography control, and from every follicle the fluid is taken out and it is sent in the lab for the embryologist. Embryologist means the one who handles the egg, the sperm, the embryos. They are the real maker. It is like playback singer. It is not the voice of a heroine. It is the playback singer who is giving the melody. Same way, whatever expert I am in making those eggs, I need to have equal dedicated in-house team of embryologists. Once I give a follicular fluid from every follicle, from each ovary, she takes them under the microscope, under absolutely sterile stringent condition, and then she takes out the egg from each and every follicle. And then they are kept in the incubator for further maturity for 3 to 4 hours. After all these eggs, they are incubated for 3 to 4 hours. These embryologists usually take the egg and either they allow the sperm to be around these egg and ask them to fertilize in the incubator, or if the patient is having or the male partner is having problem in the sperm, or if it is unexplained infertility, which everything is normal but we don't know when the pregnancy, why the pregnancy is not happening, then the special technique is used which is called ICSI, intracytoplasmic sperm injection. It means we inject the sperm into the egg. So you need a skilled embryologist who takes the sperm and inject inside the egg. Now the time taken for this entire process is less than what time I'm taking to explain you. Faster the embryologist, better the results. If you have your in-house excellent team, then it is your routine protocol. They decide, they take out the eggs, the mature eggs are separated, the eggs are injected, and they are kept in an incubator. Now, another important thing is you need to know that we have many incubators. Every patient is labeled. So, same incubator is not opened again and closed. It can disturb the environment. Now, after 24 hours, they cross-check how many eggs got fertilized. Even if every egg is injected, not necessarily you will have every so many embryos. Only healthy egg and healthy sperm. When I say healthy, it means they are mature and genetically healthy. Then only the embryo is formed. Now, every formed embryo, sometimes genetically unhealthy embryo egg or unhealthy sperm also can form the embryo, but they may not grow. So some eggs, they may not get fertilized, and some of the fertilized eggs may not grow. So you may wonder that they have taken out 10 eggs. Not necessarily you will have 10 embryos. Depending upon your age, quality, your ovarian reserve, everything, the number of embryos formed depends. Those which are not genetically healthy, probably they don't grow or they don't implant. So we segregate on third day those which are healthy embryos, and those embryos then we transfer. So friends, it looks very easy. It is not easy, the procedure. It involves a active participation and active understanding of the couple with you. If they know that they have to undergo this process, which takes sometimes from 2 weeks to 6 weeks, sometimes in a lady, for example, she has polycystic ovaries, we may downregulate the egg ovary. Sometimes she may be obese. We ask them to reduce the weight. At least 5 to 10% of the body weight should be reduced. Because now you understood that you need a healthy eggs. And obesity itself can affect the health quality of an egg. So if your ART consultant says do weight loss, they mean it, because the quality of egg is decided by you, your age, your body mass, your ovarian reserve. So your active participation in entire process is very important. Understanding by your partner, helping you to reduce your weight is equally important. Your diet, healthy diet, because all micronutrients, vitamins, minerals also make the health of the gamete. So friends, when you undergo IVF, what is important is, and why the name test tube came is, usually in the fallopian tube, the egg and sperm undergo union in a natural way. And here The function of the tube is taken by we in the lab. We make the egg and the sperm, and then this embryo is transferred in the womb. So, if you did not understand the process very well, it is mandatory for you to ask your infertility specialist, please explain it again. Why? Because when you understand that I have to take everyday injection, for example, you are mentally prepared. You know why today you are going in a ART center or to the clinic just to take the injection. You know that today after the injection, they are going to check me on a sonography to see how the rate of a growth of all my eggs are happening or the follicles are happening. So when you go knowing for what you are going, you are not stressed. That's another thing. The stress affects the egg quality. The stress causes complete imbalance in the hormone. So, you understand you need to have a healthy food. You understand if you are overweight, start exercising, do yoga, and reduce the weight because you want to improve the egg quality. And third, understand the process very well so you are not carrying any stress. Don't be stressed out to ask any team member or to your consultant, infertility specialist, any queries if you have. Because slightest query can give you the stress. And now you understood, stress also affects the egg quality. So, to get a success in a IVF, now in spite of doing all that, you should know IVF is not 100% success. It depends upon your age, your number of eggs, amount of embryos available. Why? Because suppose I decide to transfer 2 embryos, and if I have made 8 to 10 embryos, I can choose best of the 2 and my success may be high. But in your case, if I got only 2 embryos, I have no choice than to take whatever the quality those embryos are. It's like I always tell my patients, you are going to buy the tomatoes. You want to buy 1 kg. And if that vendor has only 1 kg tomato, whether they are good quality or bad quality, you have to take them. But if they have 30 kgs, you can select the best of the tomato. So naturally you will have a best one. So there are many factors which affects the result. Implantation of that embryo is a highly complex procedure. The dialogue between the mother's womb and the embryo naturally when happens, the lady doesn't even know the baby is growing unless she misses the period. But when it happens artificially, there is so much complex procedure which is involved, which is beyond the capacity of the doctor or the woman or the couple. And that's why IVF is not 100% success. On an average, younger the couple, better the result. Great number of embryos in hand, better the result. First 2 IVF cycle always will have better result than subsequent cycle. So, in this journey of IVF, yes, there are millions of babies which has formed. Millions of couple became healthy, happy. They got their generation next. And thanks to the technology, there is so much of an understanding about the subject that the success is going higher and higher decade after decade. What we used to have a success in 1980s and what we have a success today is totally different. We might have doubled, but we are not 100%. You may find in some center the IVF cost is very low, while in some center it is high. Try to understand what drug you take. The cost of the drug changes. Better the drug quality, maybe better the result. So some centers probably couple cannot afford, so may just use little better quality or lesser quality drugs. More or less, the IVF cost is same across. Only the way it is explained to you may differ. Sometimes the cost of a IVF is explained only the procedure, only the test which we do, only the embryo which we freeze, only the drugs what we use. But if you take overall cost, it may be more or less same. Also friends, it's not only getting the pregnancy. After we do the transfer of that embryo, transfer of that baby, you need to be on so many medicine. They are also expensive. Sometimes you need those medicine. They may cost you from 5,000 to 20,000 per month. So it's not only the cost of the IVF, but the cost of the pregnancy to take that baby for 9 months also should be considered and also should get explained. Otherwise, it becomes tremendous financial load on you. So I try to explain you in a very simple way what is IVF, how the procedure is involved, how the cost is involved, how these pregnancies to be taken for 9 months, you need a special care. IVF pregnancies are at little high risk than the natural pregnancies. There may be a chance of developing blood pressure, diabetes during the pregnancy. The reason may be your weight, the reason may be advanced age, or the reason may be the IVF transfer takes little bit changes in your body hormones, and that may be the reason why you may be at a higher risk of developing the blood pressure. So take care when you go for a IVF treatment. I do understand it is a physical, economical, and emotional trauma to the couple. But if your infertility specialist, their team, their counselor, their doctors, their embryologist, their staff are with you in this journey, along with your entire family support, then when you get a baby in hand, you feel it was a beautiful, blessed journey. Thank you so much for your time in listening to this.